Typhoid fever, enteric fever, Salmonella Typhi. What is typhoid? Causes, diagnosis, and treatment. Typhoid fever is very common in Pakistan, and many people also show antibiotic resistance. Worldwide, typhoid affects millions of people every year and causes hundreds of thousands of deaths. It is especially prevalent in developing countries like Pakistan. Typhoid fever is a bacterial infection that can spread throughout the body, affecting many organs. Without prompt treatment, it can lead to serious complications and can even become fatal. Typhoid fever is caused by a bacterium called Salmonella Typhi, which is related to the bacteria that cause salmonella food poisoning. How does typhoid spread? Typhoid fever is highly contagious. An infected person can excrete the bacteria in their stool. If another person consumes food or drinks water contaminated, even with a small amount of infected feces or urine, they can become infected with the bacteria and develop typhoid fever. Typhoid is most common in regions where there is poor sanitation and limited access to clean water. Good hygiene and sanitation practices can help prevent typhoid fever. Globally, children are considered most at risk for contracting typhoid. This may be because their immune systems are still developing. However, children often show milder symptoms than adults when infected. Symptoms of typhoid fever. Key symptoms include 1. A persistent fever that gradually increases day by day. 2. Headache 3. General body aches 4. Extreme fatigue 5. Cough 6. Abdominal pain, cramps, and diarrhea 7. Restlessness, weakness, and lethargy. As the infection worsens, one may lose appetite, feel nauseated, experience stomach pain, and diarrhea. Some people may also develop red spots on the chest. If left untreated, symptoms may worsen in the following weeks and the risk of fatal complications increases, such as meningitis, brain fever. Diagnosis. Typhoid is diagnosed through symptoms and blood culture tests. The Widal test and Typhidot test are not reliable for diagnosing typhoid fever and should not be done on one's own. In fact, both tests have been banned in Pakistan as they often give false positive results. Treatment of typhoid fever. Always consult a doctor for diagnosis and treatment. Self-medication, especially with antibiotics, should be avoided, as antibiotic resistance is a serious issue in Pakistan. Blood culture tests also help identify which specific antibiotic is effective against the infection. Typically, a full course of treatment lasts 7 to 14 days. In severe infections, antibiotic injections may be required. During typhoid fever, the patient should avoid solid foods like bread and instead consume easily digestible foods such as barley porridge, sago pudding, sagudana, khichdi, rice lentil mash, and fruits for 1 to 2 weeks.